Hi, it's Dr. Pavanka. In the last video, we talked a little bit about euthanasia in general. This video, I think, is going to be a little bit less uncomfortable. It's still on the topic of euthanasia and giving your pet that peace at the end, but this one's going to be focused more about making their last few days great. So our pets don't like to make it easy on us, and a lot of times they'll kind of yo-yo up and down as far as quality of life. It makes it really, really hard for us as their caretakers to go ahead and know when it's time, because you'll be at that day where you're like, oh my gosh, everything is awful, they're in pain, I need to help them. And then the next day they could be back to normal seeming, and then you have the next day where they're horrible again. So it makes it really difficult. Our general rule of thumb is going ahead and doing a quality of life quiz and planning out if they have more bad days than good. Usually we're looking at maybe it's time. It is a discussion that I would recommend talking with your whole family about, anybody who is in the day-to-day life of that pet, just so everybody's on board and everybody understands. A lot of times the when is really dependent on the who, as far as different families are more willing to try more things versus more willing to let them go sooner so that they don't have any pain. And it's not necessarily a right or wrong question or answer. It really depends on you, your pet, your lifestyle, your family. I would say if we do that quality of life handout, the quality of life quiz, and everything is awful, I would say that's probably likely the time to let them go. But a lot of times I kind of look at a couple of different things, but as far as, is it something that we can help them through, or are they still happy? Are we still having good quality of life? I honestly went a little bit step further because with my pets, I use a lot of my quality of life assessment also has to do with budgeting too, because that's a very important part of how we take care of our pets and our family. I went to William Woods University, which they have a program. They're actually, I think, one of the only programs with horses that have all 4 disciplines of riding. They have saddle seat, dressage, hunter jumper, and western. And with that, they needed to figure out a good way of managing their horses, because a lot of times when we have our animals, we really get attached and we want to just do the next thing. But as a college, they're looking at donated funds and trying to focus on the budget that they have through tuition and those donations from alum. So what I was told when I was there was that for their horses, they look at the benefit of the horse in that program, and then they have one big surgery. So they had a couple horses that would colic every time they went to a show, so they stopped going to shows with those horses. But they also would potentially pay for more than one colic surgery for those horses too, because the 2 that I can think of off the top of my head, Desi and Tango, they were wonderful lesson horses, and they were very valuable to the program. And because they were such a benefit to the school, they got a lot more leeway with their surgeries. But I took that kind of the price tag that they had as far as what they could do as far as their budgeting, and I adopted that with my own pets. So it's really helped me, because I look at it as I allow my pets one big surgery unless there's other extenuating factors. I had one of my own who, she was very tricky, and despite my best efforts, she had 3 foreign bodies, that she ate toys and other things that she shouldn't have in 2 years of life. And I had to make that difficult call, because we did our one big exploratory foreign body surgery in her, and she did not recover well. She recovered, but it was a long, hard road. So when it came to 6 months later, when she found her next victim of whatever she ate and was feeling very sick, I made that difficult decision, which I still have a hard time thinking about it, but I know that it was the right choice for her, because she just did not do well with keeping things out of her mouth like that. And if I had tightened down anymore, her quality of life wouldn't have been there. So a lot of times we do have to look at that too as far as the budgeting. And sometimes the pets get some diseases and some conditions that are really, really hard to manage or really expensive to manage. And you're looking at what's best for them. Is it something that can be afforded, or is it something that just isn't budgetable? And some rescues, you can go ahead and surrender them and they'll be able to manage them and find them new homes, but that's not always the case. So I do recommend looking at budgeting, looking at cost benefit of treatment if it is something like that. Is there any other therapies we could try? A lot of times we used to euthanize a lot for osteoarthritis, and I've had a couple allergy dogs that we've had to euthanize. And a lot of times when we get to that point, we've exhausted all of our other options, and we're looking at quality of life is just not there because we've gone through everything and nothing's working. So typically, like in the other video, you go ahead, you do your quality of life assessment, you look at the budget and see, is there any way that we have anything else on the table that we can use? Or if it is something that needs surgery, what can I do? Is there anything else I can do? And then you discuss it with your family, and you are open and clear as far as, hey, you know what, this is what we're seeing with Fluffy, and you know what, this is kind of the point we're at. I really like bucket lists, making sure everybody has a list of different things they want to do, and going through those with the pet before it's time for euthanasia. Other people will also bring them out for food. I know in my clinic we have a little caddy that has peanut butter cups and Hershey's Kisses and other things that they can't necessarily have normally because chocolate, but they've really wanted for years because chocolate, and they don't get those, and they can go ahead and have some last treats in there, but doing the things that they love with them before you let them go. And a lot of times once you do that and you make sure that you tell them that you love them daily, and you get through that bucket list, you get them their food, whatever, a lot of times that's a more peaceful passing than letting it go at home. So I do recommend doing that planning and figuring out where we're at in the hospice care. Some people do prefer home euthanasias too. Those are one that can be a little bit more difficult just because some animals feel more threatened with a stranger coming in their home and asking for sedation injections and other things that are a little bit more invasive. And I will say that it's kind of hard from a veterinary planning aspect too, because we're looking at getting out to your home and making sure that the pet is in an area where we're not gonna have any issues. I've had some that we euthanized them outside, which kind of made me nervous for cats, but it is sometimes nice to go ahead and do it in their environment where they're comfortable. When I worked at a different clinic where we did more large animal and farm calls, I had just a really big dog that couldn't get into the clinic before or again, and we did his euthanasia at home. That said, you want to make sure you have your body care figured out. If you do bring your pets with you, you need to make sure that you have a secondary plan, because I've had that happen before where we euthanized the horse in front of the other horse and the other horse decided to wake him up. So there was some kicking, biting, and pawing trying to get Buddy up, and we didn't have a way to separate them. So it was a lot of emotional damage for that client because she had not thought that that would be the option. Sometimes they don't seem to care too much when you have the other pet there. They're like, okay, cool, this is done now. But there are some that really want to wake them up, and it's pretty difficult to wake up the dead. So they will go ahead and like nip, paw, kick, depending on what animal. But sometimes that's nice for them to have that closure too. It's one of those things that a lot of the things with hospice and euthanasia are more closure and personality and individual preference. So do let me know if you have any questions. I will see if I can link in Dr. Mary Gardner as far as she has some wonderful quality of life handouts and wonderful information about euthanasia. And a lot of times she even has a little bit of information about caretaker fatigue too, because that's one thing that we don't think of as much. But a lot of times we do get to that point where we almost bury them before they're dead because you know it's coming and you don't want it to happen. But then also you have that caretaker fatigue where you just get burnt out because you've been trying to deal with so much for them. This is a longer video and it's not a very comfortable video, I'm sorry, but I wanted to make sure that I went through it because it's one thing that doesn't seem to get talked about as much. We're getting better at vet med talking about it, but I did want to make sure that I had a resource, and it's probably not one that I'm going to be readily wanting to share with my clients, but I figured that if you stumble onto it, maybe I can help somebody kind of guide their choice as far as how they want to deal with hospice care, because it's not an easy thing by any means.